Hello and welcome to yet another episode of Dotor in the House on Herald TV, and today we are going to be discussing laser vision correction, or commonly known as LASIK surgery. And with me today I have Dr. Chandraprakash Oli. He is a consultant ophthalmologist at the ASG Eye Hospital from located in Karanzale, and someone who is known in Goa who knows Goa for a long time. He has done his MBBS from GMC and completed his further studies in Hyderabad with more than a decade's experience in LASIK surgery. Welcome to the show, Doctor.
Hello, sir.
Doctor, let's directly get into the point of what we are going to be discussing today. Yes. And the first question that I would throw at you is, what is laser vision correction?
Okay, so laser vision correction, which is commonly known as LASIK, it's a type of eye surgery wherein we remove the power of the glasses from the eye. So a patient who wants to get rid of a glasses or contact lens, they can undergo a surgery known as LASIK or laser vision correction.
Okay. And how does the LASIK surgery work?
Okay, so basically what we do in LASIK is we use specialized type of laser which is known as excimer laser. So with this excimer laser, this is how I'll explain in the eye model. Okay. So this is the eye. So in eye, this front part of the eye is known as cornea. So laser works on this part of the eye. Okay. So basically it reshapes the shape of this front part of the eye, which is known as cornea, and thereby eliminates the need of wearing glasses or contact lens. So basically it involves reshaping the front part of the eye. Okay. And changing the refractive status of the eye, that is changing the power of the eye.
So we have a question related to the same, and we have Vaibhav, one of our audience, calling in.
Hello doctor, माझें नाव वैभव राजमणी आणि माझं क्वेश्चन आशिल्लो दॅट LASIK सर्जरी म्हणटा ते एक्चुअली कितें म्हळ्यार कितें स्टेप्स आसता what actually happens in LASIK surgery? I just want to know about that.
Okay. So
a procedural question as to what exactly happens.
So first of all, we must know why we wear glasses. People who wear glasses, there's a reason for that, why they wear glasses. See, if you want to see any object, the rays coming from the object, it passes through the different parts of the eye. First part of the eye is known as the cornea. Then it goes to the lens, which is the second part of the eye, and finally it should get focus on the retina. So only if the image of that object falls on the retina, we can see the image clearly. In people who wear glasses, either in minus power or plus power, there is in minus power, what happens? The image is formed here in front of the retina. So the patient is requiring a minus glass to shift the focus from here to on the retina. And in plus power, the image is formed focused behind the retina. So he requires a plus power glasses to wear to focus on the retina. So in LASIK, what we do, we change this refractive status of the eye. Means we change the curvature of the front part of the eye with a laser, which is the excimer laser, so that he doesn't require glasses, either plus, minus power or cylindrical power. And he is able to focus the rays directly on the retina even without glasses. So that is what basically happens. Basically reshaping of the front part of the eye, which is the cornea, using a specialized laser known as the excimer laser.
Okay. And so, doctor, who is eligible for this? I mean, how does one determine whether I am a very good candidate, or can I be the one who goes for the surgery?
There are certain major criteria to follow before doing a LASIK. The first and most important is the age criteria. So your age should be more than 18 years. Less than 18 years, you can't do LASIK. Okay. Second thing, and the important thing, is the stability of your eye power. Means your power of the glasses is stable or not. It should be stable for at least 1 year. Suppose you have a -4 power today. After 1 year, it becomes -6 or -7. We can't do. But if remains -4 or maximum 0.5 variation, then we can do the LASIK. So second is the stability of the power. The power of the glasses should be stable within a year. Okay. And third important thing is, you should not have any eye disease or eye condition which is excluding the contraindication for LASIK. Like certain eye disease, like you have a severe dry eye, or if you have a eye infection, if you have a glaucoma or uveitis, this type of eye disease, we can't do LASIK. Okay. And the fourth important point is the thickness of the cornea. As I've told you, this is the front part of the eye where the LASIK is done. And LASIK basically involves reshaping, I've told you. So if the thickness of the cornea is very thin, we can't reshape it, because the amount of cornea which is left after LASIK will be less. and it will not hold the position. It will not hold the shape. It will become very weak. So in people who are having thin corneas, the criteria for us is 500 microns. So if it is less than 500 microns, we can't do LASIK.
Okay. Before we move on, we have a couple of more questions coming in from our audience. This is Praveen. He has got a question for you.
Hi, I'm Praveen Borkar. Is there any specific age or conditions before going for LASIK?
Yeah, so to answer the question of Praveen, so I've told the age.
Yeah.
It should be more than 18 years. There is no upper limit for doing LASIK. But you have to remember that after certain age group, you require certain eye condition develop. Like after 40 years of age, you require reading glasses. And reading glasses power is more related to the tone of your eye muscles, the weakness of the eye muscle. It is not related to the shape of the cornea or the lens power. So that will be a progressive condition. The LASIK will not correct that progressive condition. After 60 years of age, you usually develop cataract. So laser will not correct that cataract surgery. So people who are little elderly can undergo LASIK, but there is a limitation for the vision. Like for near, you will require glasses, and if you develop cataract in the future, you have to undergo cataract surgery. So that will not be taken care by LASIK. LASIK will only correct your distance vision. Okay. So that is the thing.
So whenever someone comes to you for, a surgery, obviously he goes through the procedures of first whether he's eligible for that or not. You check
so
on that.
what we do something known as LASIK investigation to check the fitness for LASIK. So what we suppose a person comes to me, I'll see his age first, then I'll see his refractive status. I will see his power, what was 1 year before, what is now. After I feel that his age is more than 18, his power is stable, then we do certain tests which are known as LASIK investigation. First we do what is known as corneal topography. Corneal topography means we are mapping the front part of the eye to see the surface, how it is regular or not, if the thickness is adequate or not, that we check. Then third we do what is known as dryness test to see if he has a dryness or not. People having dryness, we can't do LASIK because LASIK itself causes mild dryness. If the person is already having severe dryness, it will aggravate. So in those patients, we can't do LASIK. And the final thing what we do is a retina evaluation. We have to know if any other causes for vision loss is there in the eye. If the patient is having some retina condition, that has to be treated prior doing the LASIK. So we evaluate all the eye from front to back before doing LASIK. And only if all the parameters are normal, then only we proceed for LASIK. And we term as fit for LASIK.
Okay. So we have a question from one of our viewers. His name is Rakesh. Let's listen to that question.
Hi, my name is Rakesh Desai and I'm from Margaon. Do some medical conditions exclude one from getting LASIK?
Yeah. So there are certain medical condition which affects the healing of the LASIK. Okay. So those conditions which affect the healing of the LASIK are supposed to be not to be done. Like for example, autoimmune condition. There are various autoimmune conditions like rheumatoid arthritis, SLE is there, then Sjogren's syndrome are there. So any condition, even uncontrolled diabetes, if the patient is having very uncontrolled diabetes, then also we can't do LASIK because it will affect the healing of the wound.
Okay.
So the patient who are having uncontrolled diabetes, autoimmune conditions, we can't do LASIK. Or any active eye infection, we can't do LASIK.
Commonly there's one misnomer or a myth that when you do anything with regard to laser surgery, it's never an injury or the way you have a wound when you cut through.
Yeah, it's a cut. It's a cut using a laser, which is very precise, and the precision is at microns level.
Okay.
But still, it has to heal. The healing is there. Body will react with that whatever you are doing. There is an injury, but not like a normal cut injury. Okay. But that injury will induce some healing process. And if you are having autoimmune condition where your immunity is very not good, the healing will not occur, and that will affect your outcome. Also, chances of infection increases. So in such conditions, we don't do.
So in that case, doctor, firstly, is LASIK surgery painful, and how long does it take to recover?
So the LASIK is something which is very popular and very commonly known to general public because of the two reasons. One is the wow factor attached with it. What is the wow factor is that immediately after the LASIK you are able to see everything clearly, and that is a drastic difference before and after. So people are very much wowed by that factor. And second is, it is a painless and precise procedure. So what we do in LASIK is, we'll take the patient on the laser machine, we'll put some numbing drops that will numb your pain sensation. And after that, we'll start the procedure, and the actual laser procedure, what occurs, hardly takes 10 to 15 minutes. After that, you are able to do all your activities. Slight pain, irritation you will feel for 1 or 2 days. After that, everything can be done. So usually it is a very painless, very safe, and the recovery is very fast. That's why it is very popular, the LASIK surgery. There are other type of also surgery which are not so popular because it is painful and there is a recovery is slow. But LASIK is very popular to general public because it is precise, the recovery is fast, and there is painless.
So the patient is awake through the throughout the surgery.
He moves his eyes, everything. We don't give any injection, we don't patch the eye, we just put a numbing drops, and under the machine we create a flap first and then fire a laser.
Okay.
And within a few minutes he is able to see everything very clearly. But certain precautions you have to follow after surgery. You can't be very relaxed after the surgery. Means you can't be like roaming on here and there. But he is able to see everything very clearly, and patient is very wowed after that. Many people say it's a life-changing moment for them. Suddenly, without glasses, they are able to see. Suddenly, many patients are not able to see even 1 meter without glasses. And suddenly, after LASIK, they are able to see the far distance object. And they are very emotional, and they cry also, many people, after LASIK.
So basically, it's not something usually when you speak about eye operations, you have immediately after your surgery, you have a patch on your eye and of that
Now,
sort.
modern days, cataract surgery also is painless. You must be knowing it. Previously, cataract surgery used to be painful, injection. Now, modern day, even cataract surgery, patient has a good vision recovery immediately after surgery. And we don't require to give injection, patch, or give a stitch, anything. It is painless, stitchless, everything. Same with the LASIK. So this is one of the most popularly performed surgery with a high visual outcome.
Doctor, we'll discuss further on this, and also we'll talk about the precautions that one needs to take, and there are many more questions from our viewers that will take after a short break. We will be there. So viewers, be there, and we will discuss more the precautions as well as some of your own questions which have come to us. So we will be right back in a short break. Welcome back. You are watching Herald TV, and this is your show Dotor in the House. And today we are discussing LASIK surgery, or which is normally known as LASIK surgery or laser vision correction. And with me, I have Dr. Chandraprakash Oli, who is a consultant ophthalmologist at the ASG Eye Hospital in Karanzale. So, Doctor, moving ahead, when can one return to his normal activities or work once he or she undergoes a LASIK surgery?
Okay. So as I've told you before, see, after LASIK, you immediately are able to see clearly. Okay. But certain precautions we have to follow because the healing of the eye is still going on. So what we recommend is that to take a rest for at least 1 week. Don't go outside. Don't allow any dust, smoke, or any water going inside the eye so that it heals. Patient will be able to see everything clearly. Okay. Then there are certain activities which we have to avoid after doing LASIK. One is rubbing your eyes. You can't rub your eyes. Okay. Secondly, you can't go for a swim or go for a bath in the sea or swimming pool. Okay, for at least 1 month.
Okay.
In girls who undergo LASIK, you can't apply makeup immediately after LASIK. You have to wait for at least 2 weeks. After 2 weeks, you can start applying makeup. Okay. And the third and most important thing is that avoid exposure to sunlight for a week at least. Don't go outside in the sunlight. Also, any digital devices like mobile, TV, which emit the light, you have to avoid it for a week.
Okay.
So, on an average, you can say patient will be able to see clearly after the surgery immediately, but avoid any activities for a week. After 1 week, you can do everything, provided you don't go for a swim in the swimming pool or a sea, and you don't apply makeup immediately after the surgery. Okay. So after 1 week you can do everything almost.
So like you said, use of digital devices. So do you normally provide some kind of glasses as a protection?
Yes. We give the UV protection glasses.
Okay.
so that what happens, the UV rays which are coming from the sunlight
Mm-hmm.
or the blue rays which are coming from the mobile or any screen, it affects the healing process. It slows down the healing process. So that's why we tell them to avoid for a week.
Okay.
After 1 week, you can do everything. There is no restriction except for swimming and rubbing your eyes.
Okay.
Okay, that is important.
So we have our viewer Sahil Mahale, and he has a question for you.
Yeah.
Hello doctor, I am Sahil Mahale from Parnam, Goa. I had one question that suppose a person has some medical conditions like diabetes and blood pressure. So can he do this laser surgery, and if yes, what are the problem he might face?
Okay, so I've told you before also. So diabetes and hypertension per se is not a contraindication. Okay, but if the patient is having uncontrolled diabetes, that will affect the healing process of the
Healing
LASIK.
process.
So uncontrolled diabetes or the diabetes which is affecting the retina,
Mm-hmm.
that means it is uncontrolled. We can't do LASIK because it will slow down the healing process first, so the outcome will not be desired, and second, it will cause infection because uncontrolled diabetes will lead to infection of the whatever wound we create during the LASIK. Similarly goes for the hypertension also. If you have a hypertension which is controlled, you can do LASIK. If it is uncontrolled hypertension wherein the retina is getting affected because of the hypertension, we can't do LASIK. So diabetes and hypertension, if controlled, we can do LASIK. There is no contraindication. But uncontrolled, we can't do it.
Okay. And is LASIK surgery permanent? Once
Yes,
you do it,
yes.
I mean, is it permanent
Yes,
forever?
yes. So one thing we have to remember, like LASIK, what we do is reshaping the cornea, the front part
Correct.
of the eye. So that effect is permanent.
Okay.
Okay. So, but still, certain percentage of waning of the effect of LASIK has been seen. We call it as regression. Regression means the effect of the LASIK slowly goes off, and that is very rare. It is less than 1% cases we have, and that too the number will be slight. Like suppose you have a -6, -7 before the surgery, you may get a number of -1 after many years. That too it happens in less than 1%, not in all the patient.
Okay.
That we have to remember. So mostly it is permanent. The effect is permanent. Other thing which I have told you before also, LASIK will not correct your near vision glasses. So after 40 years of age, you will require to wear reading glasses as a normal person wears.
Yes.
That will not be corrected. So and also after 60, if you get cataract, you have to undergo cataract surgery. LASIK will not correct the cataract surgery of your in future.
Okay.
So that you have to remember. Many people feel we have done LASIK, now nothing will happen to my eyes.
True.
Reading glasses, as a normal person, you have to wear same. And cataract, if you develop in future, you have to do the operation. So that will not be taken care by the LASIK, but the distance vision will be taken care by the LASIK.
Okay. So basically, as far as your reading glasses is concerned, I mean, obviously, after a certain age, if you need them, you will have to start wearing them.
Yeah.
There's no option to that.
Yeah.
Okay. Doctor, then what are the risks involved in LASIK surgery? I mean, are there any specific ones that you could point out?
Yeah. So complication, there are two terminologies for this. One is the side effect,
Yeah.
and one is the complication or a risk. So side effects which are most common is immediately after LASIK, for especially in the night, you have something known as visual aberrations. Means visual disturbances you may feel, especially at the night. People who drive at night, they may see little splitting of rays, or they may see some colored halos, especially for few months, like 1 or 2 months you will have that. That is because at night your pupil of the eye dilates. So the treated and untreated zone, there are different zones in the eye, the treated zone and the untreated zone.
Okay.
When the pupil dilates, the untreated zone comes into the focus. So at night you may experience something known as visual disturbances like splitting of light or halos, okay, which is normally seen for 1 or 2 months. After 2 to 3 months, it gets stabilizes and you are not having any visual disturbances. So this is the most common side effect which stabilizes and goes away over the period of time. The major complication which can occur are, one is known as undercorrection. Means suppose we have done a LASIK, all the power is not gone, some power is left. That is known as undercorrection. That also, all these complication chances are less than 1%. So if you do 100 cases, 1 case will have those things. So undercorrection means your power is not fully corrected, and this complication can be treated. We have to do something known as enhancement LASIK. We can do enhancement LASIK and immediately this power also will get corrected. But the most and important and the dreaded complication is the infection. Infection is something which is with any surgery in the body you do, the chances of infections are there. So that we can't, after taking all precautions, all thing, the complication of infection is always there. The risk of infection is always there. Not happens very commonly, very rarely it happens. And in the what you call the first world country also, after taking all precautions, it is still get infection. But is the rate is very like 1 in 1 lakh it happens infection. And in which patient it will happen, we don't know previously. After taking all precaution, all drops, all medicine, patient may get infection from something or other. But it is very rare. You have to remember
could be
that.
Even external reasons for
but what is important to tell, it is very rare. But if you ask me, the risk is there? Yeah, it is there. I will tell you it is not there. I will not say like that. I will say it is there, but it is very rare. So.
We have a viewer, Alistair, who is having a question for you. Let's listen.
Hi, I'm Alistair Torres, and I want to know what is the most common complication of LASIK surgery?
Yeah, as I've told you, the most common side effect you can say is visual disturbances. And the most common complication you can say is the undercorrection, which can be cured immediately. So it's not a big thing.
We have another question from one Sakshi, and let's listen into that question as well.
My name is Sakshi Naik and I'm from Panjim. My question was that what are the risks and side effects of laser eye correction surgery?
Something similar.
Yeah, I have already answered. The most common side effect I've told you is the visual disturbances like splitting of rays and halos, which goes within a few minutes. It goes.
So any precautions per se so that these things do not happen?
No. This I've told you. This occurs because of the treated and untreated zone. And it depends on the pupil size of the patient. Some people have a big pupil. Some people have a small pupil. People who are having small pupil will not experience this visual disturbances. Only people who are having big pupil, they will experience this disturbances. And that too not all patients. And that too only at night. When the light comes in front, they may notice fine splitting of rays. And that will go. That important thing is it will stabilize in 1 or 2 months. After that, you will not experience that visual disturbances.
So once somebody does LASIK surgery, can they, are there any restrictions as far as the activities are concerned, or, you spoke about, the first one or 2 weeks, but then beyond that, any specific restrictions that come into life because of, since you've done a laser surgery?
So most of the activities you can do. Only certain activities which you should avoid are any sports which involves any flying object coming. Any sports or any activities wherein the object is flying. So that may hit your eyes and it may dislodge the flap. So those activities you have to avoid. Avoid the activity in which that chances of contact is very high in the eye. All the activities and all the sports wherein the chances of contact on the eye is very high, you have to avoid it. And even if you are doing it, you have to wear a protective glasses and do it. Like you are playing shuttlecock. Sometimes it comes and hit the eye. The LASIK flap can get dislodged. If it is coming in the very high speed and hitting your cornea, it can dislodge the flap of the cornea. So you can play it with a protective glasses so that it will not hit your eyes directly. So all those activities wherein chances of contact to the eye is very high, you have to avoid it. In long term, I am saying it.
So I actually wanted to ask you with regard to that itself, like, most of the time nowadays two-wheelers are the most common mode of transport. So does doing a LASIK surgery then have restrictions on because of the speed or the
because
dust?
of the wind, speed, it will not get affected. What I have told you, it requires a very high force to hit the eye, not dust also, some piercing object or some that should hit the eye, then it will dislodge. Otherwise, normal wind, dust will not dislodge this. There is no restriction for that. You can drive your two-wheelers also after doing LASIK, no problem.
So this was all about people who are doing LASIK surgery. But as I said, when you do a diagnosis, initial diagnosis, and if somebody is found unfit for LASIK, then what are the options for that person?
The most common cause for being unfit for LASIK are the corneal thickness. I've told you in LASIK we are measuring the corneal thickness because we are carving the corneal thickness. The criteria for LASIK is 500 microns. I have told you. Somebody who is having less than 500 microns and still he is interested in doing LASIK, there is one more procedure which is known as PRK, photorefractive keratectomy. It is same like LASIK only, but instead of doing a flap, we scrape the front layer of the eye and then we pass the laser. So that we can do up to thickness of 475. So person having less than 500 up to 475, we can do a procedure known as PRK. The only downside of this procedure is recovery is slow. It's not like LASIK. Immediately you are able to see clearly. For a clearer vision, it takes at least 2 weeks.
Okay.
And the initial, there will be discomfort after doing PRK, because that layer which we have scraped, it has to heal on its own. That healing takes time. So you may experience little watering, redness, itching, pain for a few weeks initially, and after a few weeks we will have a vision which is equivalent to LASIK. So people who are having between 500, less than 500, but up to 475, we can do PRK. Now what if it is less than 475?
Yeah.
In these people, we can't do either PRK, we can't do LASIK. Then we have a third options, which is known as the ICL. So ICL, how it works is that ICL means implantable contact lens. Like how you put contact lens outside. The normal contact lens we put outside on the cornea. This is an implantable contact lens, means we are putting it inside the eye. So there is a natural lens of your eye. In front of that natural lens, we put one more lens.
No.
Just this is a natural lens, we put a artificial lens in front of the eye, and this will work like your spectacle or contact lens.
Okay.
And you are able to see clearly. So since in this procedure we are not touching this part of the eye, so thickness won't matter for us. We are putting in front of your lens, artificial lens, and that will take care of your refractive status, and you are able to see clearly like LASIK or PRK. ICL.
So just last question on that. So are there risks involved with that? Because since you're saying it's not going to be touched and there's going to be an artificial lens, because normally when you talk about lenses, you need to keep changing them and stuff. So what about this one?
This lens is not something which you have to change again and again. So this lens sits in front of your natural lens. So complications are slightly more, because what we do in LASIK is outside the eye. And this we are doing something inside the eye. Okay, complications are there. Chance of most common complication is infection, which rarely happens. Other complication which can happen is that sometimes this artificial lens touches your normal lens. Normally there is a gap between your artificial lens and the natural lens. If it touches your normal lens, what you have inside your eye, it can develop cataract. Okay. So this is a quite safe procedure. We have to measure a lot of parameters before putting the lens. We put a lens in such a way there is no touch between your lens, natural lens, and the artificial lens. Okay.
The last question, but a very obvious answer would I know, but are all these procedures available at the ASG Eye Hospital in Karanjali?
Yes. So at ASG Eye Hospital we have all the procedures, be it LASIK, be it PRK, be it ICL.
Okay.
So all 3 types of procedure we are having at a LASIK procedure, and the ICL procedure can be done at ASG Hospital, Goa.
Okay. Thank you, doctor, for that informative session on laser vision correction, and commonly known as LASIK surgery. So viewers, do watch Dotor in the House every Sunday at 11 a.m. and for all your, if you want to watch it again, go to our social media platforms and it's available there. It's on YouTube, and our next episode would be on cataract, and we will have again Dr. Chandraprakash Oli with us, who is a consultant ophthalmologist at the ASG Eye Hospital in Karanjali. If you have questions, queries with regard to cataract, please do send in your voice messages on our number on WhatsApp, and we will have Dr. Chandraprakash Oli answer your questions. So thank you for watching this episode, and keep watching Herald TV for more.